to this new concept of a journal club discussion. And in this series, we will be discussing new articles and new surgical techniques pertaining to arthroscopy. So, what I want you is to first put the vote here. So, how many of us are doing a BTB ACL surgery? And then we will be starting the discussion. So, this discussion is on the article of anterior cruciate ligament reconstruction using BTB autograft with press fit femoral fixation, the original chamber technique by Levy et al. In Arthroscopy Techniques 2022, a very recent article written by group of Dr. Pierre Chambart and Dr. Bertrand Sonnery-Cottet. It's an excellent article, and it emphasizes on a lot of techniques pertaining to BTB graft. So just put on the how many of us are doing a BTB ACL surgery overall. So we have five votes till now, and only one vote is in favor that we are doing a BTB surgery. So BTB surgery is actually a very it's actually called as a gold standard of the ACL reconstruction. And when I started my fellowship, a lot of ACL reconstructions were done by BTB. The main fellowship director under whom I was trained, who used to do ACL with the BTB technique. Meanwhile, I'll also invite you to put your questions on the chat box so that we can discuss about the pertaining thing. So the advantages and the disadvantages of BTB ACL surgery we will be discussing up here. The most important advantage of a BTB ACL, that is a very solid graft, the bone-to-bone healing is very good, and the chances of late laxity in cases of BTB ACL surgery is actually less as compared to the late laxity which we encounter in the soft tissue grafts like hamstring and peroneus. So once it heals, so because it is a tendon, it has got a lesser creep effect. So whenever we do a BTB surgery, the creep effect is less, and you get a good outcome at a long term. And bone to bone healing is good, so the patients can be mobilized faster. So some people do it in all the cases, some people do in few cases, but overall the trend is going against the BTB surgery. Although the surgery itself or the technique graft per se is a very good graft. Now there are some technical challenges or technical difficulties when we do a BTB graft, and this technique per se solves a lot of these techniques. So what happens is whenever you do a BTB surgery, there are some inherent issues which can lead to problems. So these problems can be addressed by a lot of things that we do. The first thing that is there is you can have a length mismatch. So what happens is when we are doing a BTB reconstruction in a patient with patella alta, you may have a tendon which is very long, and if you fix the femur, then on the tibia, the bone graft is actually out of the tibia tunnel. So that is one thing that we have seen. The other problem is the fixation on the femur. So femoral fixation is usually classically described by using a interference screw. So that is inserted from the intra-articular side, and that is usually a tricky step. You need to do a notching. So ideally you may need to make a notch with a screw and then put a screw into that hole. So that relatively becomes tricky sometime. So that is one issue which is also addressed in this particular technique. And the other thing is it a little bit bigger scar, which is also addressed in this technique. So the salient features of this technique are, number one, this technique usually takes into account 2 to 3 things. So number one, it is a 2 incision harvest. So normally when we were fellows and we were doing BTB ACL, the ACL was done with a single incision, midline incision, and we used to take the patella bone graft and the tibial bone graft. So instead of that, here they have made 2 incisions, one on the patella and one on the tibia. The second thing is they have reversed the graft. So what we used to do, we used to use patella for the femur and the tibia for the tibia. So now in this particular technique, they have actually reversed the graft sequence. So they use the tibial part for the femur and the patella part for the tibia. The other thing that they have done is they have done a outside in drilling of the femur. So the femur, you make it the anatomical insertion and put a outside in jig, and with the outside in jig you can pass your tunnel. The fourth thing that they have done is they have avoided the use of any implant on the femur. And that is very exciting thing, because what they do is they will the other thing they have done is they are passing the graft in the reverse manner. So what we usually are trying to do is we are passing the graft from the tibia to femur. In all the cases, if you are doing a soft tissue graft or any graft, we are pulling the graft from the tibia to femur. So now this graft will be pulled from the femur to tibia. So, and the tibial side of the graft will be on the femur. So that makes an advantage, because you make a graft which is trapezoidal and you punch the graft into the uh, femoral femoral drill, basically the femoral part. So what it does, it you need to, what they say is you need to do a sequential reaming. So about, so if you have a 11 reamer, so drill 10 for the femur, and then the mouth you can drill with 11. So what that will do is, when you pull the graft and when you impact it on the femur, so in the last step you can impact it on the femur, and that can actually lead to a press fit fixation on the femur. And then on the tibial side you will have you can do a fixation of the patellar graft with the interference screw, and you can actually do a double fixation also on the uh, tibial side. So that makes it it's a promising technique, specifically in cases of revision surgeries, and it is a promising technique if you are trying to do some of your cases, of you plan to do some of your cases as a primary BTB reconstruction procedure. So it decreases the chances of the paresthesis on the medial side because it is two incision. But the important thing is you need to have some special instruments. The special instrument is a double blade knife, which you need to harvest the central patellar tendon. You need to have good quality saw blades to actually put incisions, and to take out the graft. Good quality incisions, good quality grafts. You need to good quality saw blade to take proper grafts, and then you need to make the tibial side graft into a trapezoidal fashion so that it press fits into the femoral tunnel really nicely. So these are the important thing. I am putting another question. So the first poll is actually landed up as two votes in favor that they have done BTB ACL, and the other ones is they have done. So my next poll is basically about the fixation on femur. So femoral fixation, what is your choice? Screw or screw or button? So you can answer into that. If you are doing a BTB ACL, what is your fixation of choice for the femur? So this is one thing that I am putting into the poll. In between, if you have any questions pertaining to this technique, you can just ask, and any questions or any discussion pertaining to the BTB ACL surgery, we can discuss out here. So by and large, at present, if you ask me, the ACL BTB surgery is usually a surgery which I keep reserved for my cases of either revision scenarios or in cases of a multi-ligament scenarios. More because of ease factor. As far as the results are concerned, I still feel that the older cases of the BTB ACL reconstruction that I have done have actually a very good follow-up and very good stability as compared to the ACL with hamstrings that we are doing at this moment of time. But the chances of less graft or donor side morbidity, and less chances of complications are taking us now to use more of the soft tissue grafts like hamstrings, and now so in some cases peroneus grafts as well. So that is, so most of them, if you are using, Mukesh has answered screw. So most of us, if you are using a BTB graft, you are using femoral fixation as a screw. But this technique is definitely worthwhile to try if you are doing BTB surgeries, BTB ACL reconstruction. So you can try this technique. It avoids the use of a difficult step, and then it makes it look more promising, and you can use it in revision scenario as well. So yes, the question is, in the multi-ligament cases, the BTB is superior to the peroneus. Basically the BTB, what I think the predominant advantage is the late laxity in BTB is less. So because there is no creep, it's a tendon. So the more important thing is the patients who are hyperlax, and those patients, typically sports person or very obese patients, in those you feel a high chances of failures. You will actually do very well with the grafts like BTB or quadriceps. So anyway, but peroneus is a very good graft, but and it's easy to harvest and easy to take as compared to BTB. So that's why BTB is going out of fashion. Although technically or result-wise, I will presume that BTB is a better graft, will provide more sort of a rigid fixation as compared to a soft tissue graft. Okay, so thank you. This was a basically an experiment. So if you like it, we'll go on with further journal clubs, and we'll be putting more and more these side of new articles which are promising and which are pertaining to newer techniques in arthroscopy. Thank you.